So today we are starting off with the Valproate PYQ series. So this is a question from 2025 of NEETPG. So a 40-year-old woman with bipolar disorder is planning for pregnancy. Which of the following drugs must be avoided due to possibility of neural tube defects? A. Valproate, B is oxcarbazepine, C is lamotrigine, and D is levetiracetam. So out of all of this, as it has been mentioned specifically as neural tube defect, so our answer would be valproate. Okay, so valproate of all of this is specifically producing neural tube defects. Okay, so we can see the quotations from Kaplan setup as well as the graph. So valproate is having 20.3%. That is the highest risk, although it is dose related. Second is phenytoin, that is 10.7%. Third is carbamazepine, 8.2%. Fourth, the least is lamotrigine, which is 1%, which is why lamotrigine is preferred for reproductive age females who are uh, preferably having some planning for their pregnancy as well. Okay, so one of the teaching is to avoid valproate in women of childbearing age wherever an alternative exists, and if unavoidable, treat it with high dose folate. Okay. Now the reason is this. Okay. The reason is the risk with valproate is 10 to 20 times higher, which doesn't justify its usage in pregnant females. Okay. So in pregnant females, whenever we try to use, we use lamotrigine. If nothing else is possible, we give valproate. Otherwise, it will be very much prudent not to give valproate. Okay, this is what is written. So, lamotrigine has the lowest malformation rate of the anticonvulsants compared to the cited data, that is 1%, and is often preferred mood stabilizer alternative for pregnancy planning. Oxcarbazepine and levetiracetam are not associated with the same magnitude of neural tube defects risk as valproate, but they are nonetheless not as safe as lamotrigine as well. And other thing is that oxcarbazepine and levetiracetam are not effective as mood stabilizers. Okay, because in the question it is not about anti-seizure medication, it is about bipolar disorder maintenance. Okay, now why is this important? Because many of the times you might find some article or some seniors might be talking about, or some even references might talk about oxcarbazepine because it is derived from carbazepine, and you might think that carbazepine was an effective mood stabilizer. So oxcarbazepine might also become an effective mood stabilizer, but that is not the case. Oxcarbazepine has not been found to have any evidence in mood stabilizers, and levetiracetam never had any in the first place. So oxcarbazepine and levetiracetam can never be our choice because it doesn't has any mood stabilizing property. Okay, thus the answer is valproate. Okay, and and lamotrigine as the mood stabilizers. Okay, but if we have to choose in pregnancy, then it becomes lamotrigine, which is a preferred agent because of the safety profile as compared to the valproate. Okay, so in total, if somebody with bipolar disorder is having pregnancy, we must look for agents that are safe for the baby as well as for the mother. Lamotrigine becomes a choice. If nothing else is working, then only we can give valproate. The other options are also lithium, but that is also having some other problems which we had discussed in the lithium series. Thank you. Hope you have learned something from this.